In 2023, Africa's journey to enhance its vaccine manufacturing capabilities and achieve vaccine self-sufficiency is underway. On the African continent, the stark reality is that less than 1% of vaccines administered are locally produced, leaving African countries heavily dependent on external sources. During the COVID-19 pandemic, the vulnerabilities of African healthcare systems became more evident than ever. Limited vaccine supplies and delays in acquiring vaccines compared to other regions highlighted the need for enhanced local vaccine manufacturing.
Throughout this pandemic, Africa has demonstrated that it has extensive and substantial capabilities, as well as resources and skills to address the challenges that are given rise by the pandemic. Africa's response has shown the depth of scientific expertise on the continent and has provided an opportunity for unprecedented scientific collaboration.
Vaccine equity cannot be guaranteed by goodwill alone, as we have seen many examples to convince all of us. Africa needs to expand production capacity for vaccines and other essential medical products.
Recognizing the urgency of the situation, the African Union in 2021 established the Partnerships for African Vaccine Manufacturing, PAVM, which aims to enable the African vaccine manufacturing industry to develop, produce and supply 60% of the total vaccine doses required on the continent by 2040. This goal includes producing at least 1.5 billion vaccine doses annually. The creation of PAVM marked a significant milestone in Africa's journey toward establishing its vaccine production capabilities.
The new public health order is a long-term strategy, a vision that our head of state decided to approve for the public health in Africa. This is a blueprint and a contribution for Africa to the global health security.
Aligning with this goal, the African Union and the Africa Centers for Disease Control and Prevention together have called for a new public health order which will safeguard the health and economic security of the continent. A key pillar of this mandate seeks to expand the local manufacture of vaccines, diagnostics, and therapeutics. In the push to realize this new public health order for Africa, PAVM identified 8 enablers to develop a viable and sustainable vaccine manufacturing ecosystem, which includes research and development alongside talent development as critical pillars. The PAVM framework for action underscores the necessity of a skilled workforce to advance the vaccine manufacturing industry. In response to this need, the Africa CDC has launched targeted short course training in vaccine manufacturing. A prime example was the program held at Texas A&M University, a collaboration with the National Center for Therapeutics Manufacturing, NCTM. This strategic partnership is facilitating the empowerment of vaccine manufacturing professionals through intensive short courses. These initiatives are more than just education. They are investments in the future of African health security. By fostering a team of skilled professionals, Africa is laying down the foundation for a robust, self-sufficient vaccine industry.
Our head of state, they decided to task Africa CDC to develop a program that will help us by the 2040 to have at least 60% of vaccines, therapeutics, and diagnostics used in Africa coming from Africa.
Under the Saving Lives and Livelihoods Initiative, a partnership with the Africa CDC and MasterCard Foundation, one of the key pillars was the development of the workforce for vaccine manufacturing in Africa.
Now, this initiative in many ways mirrors the principles, the tenets of what it is that forms a new public health order for Africa. Achieving this future will take partnership, and not just any partnership, but partnership that's rooted in respect.
As of August 2023, the initiative has expanded laboratory capacity for genomic sequencing across the continent. Rwanda's remarkable strides in local vaccine manufacturing, including hosting Africa's first mobile vaccine production units in collaboration with BioNTech, exemplify their unwavering dedication to achieving vaccine access equity and tackling global health crisis. Morocco's impressive progress in local vaccine manufacturing is showcased by the creation of the Sensio Pharmatech plant, solely dedicated to producing and distributing vaccines, including those against COVID-19. And in Senegal, the Institut Pasteur de Dakar has become a crucial player in Africa's mission for vaccine independence. Senegal's bold projects like the Madiba Initiative are revolutionizing vaccine production and championing health security and sovereignty not only for Senegal but for the entire continent. As part of this initiative, Institut Pasteur de Dakar also partnered with the MasterCard Foundation to develop a world-class workforce to revolutionize vaccine manufacturing in Africa. With the acronym MADIBA standing for Manufacturing in Africa for Disease, Immunization and Building Autonomy, this $45 million program is establishing a center of training excellence for vaccine manufacturing. The Madiba project aligned with the bold Senegal Emergent Plan, which aims to manufacture 50% of the country's pharmaceutical products domestically by 2035.
We have only 1% of vaccines used in Africa coming from Africa. We have only 5% of diagnostics used in Africa coming from Africa. That one is exposing our continent if there is any other outbreak.
By fostering the growth of a skilled workforce and strengthening vaccine manufacturing capabilities, the Madiba project contributes to this vision and is part of a larger strategy to enhance vaccine manufacturing capacity across the WAMO region and across Africa. Collaborations like the Saving Lives and Livelihoods Initiative and the Madiba project will have a transformative impact on Africa. By fostering expertise, enhancing local manufacturing capabilities, and strengthening research capacities, these initiatives position Africa to better respond to health crises. With strengthened vaccine manufacturing capabilities, skilled workforce, and enhanced healthcare infrastructure, Africa would be poised to overcome challenges and build a brighter, healthier future for its population.
Health is a fundamental human right, an end in itself, also a means to development. A healthier world is a safer, fairer, more peaceful, and more prosperous world.